Anabella Aspiras, and I am the Assistant Director for Cancer Moonshot Engagement on the Biden Cancer Moonshot. The Cancer Moonshot is a White House-led effort to end cancer as we know it. The President and First Lady, for whom cancer is deeply personal, reignited the Cancer Moonshot in February of 2022 to accomplish two goals that they set forth. The first is to decrease the death rate from cancer by at least 50% in the next 25 years, effectively sparing 4 million lives by 2047. And the second goal is to boost support for people living with and surviving cancer today. Through the work of the Cancer Moonshot and the leadership of the President and the First Lady, we now have 6 codes to bill for navigation services. Prior to these codes, there was not a systematic way of reimbursing for navigation services, which meant that unless you had the overhead or administrative budget to pay for staff to do navigation, you may not be providing navigation, which left navigation services out of reach of too many practices, particularly lower resourced settings. We made making navigation accessible to as many Americans as possible a priority because it does chiefly 3 things. It improves health outcomes. It decreases healthcare costs. Many patients who receive navigation don't end up in the emergency room as much, for example. And then last but not least, it advances health equity by creating time, space, and resourcing for individuals who may have less trust in the healthcare system to receive that additional support. If you were a facility already providing navigation without these codes, we hope that you can scale your navigation services to even more patients. If you were a facility that wasn't doing navigation, hopefully these codes will allow for revenue that can bring on staff to start providing navigation services. I think it could just grow awareness, recognition, and boost support for the navigation workforce. Suddenly someone who had never created a line item to hire a community health worker to be a patient navigator for them might think about it again because they've heard or they've seen other practices onboard and hire navigators. In this year 1, I hope to see as much uptake as we could possibly expect in terms of using these codes to advance navigation practice. That is a tremendous first step. That said, it is the first bite at the apple, and it will take time for organizations to adopt these codes, and then for us to be able to gain insights from their utilization to understand where the gaps and opportunities are in making these codes most effective, or, quite frankly, understanding what the limits of these codes are so that we can look at things that are in the gaps and understand what payment mechanisms need to either be made or retooled to address those gaps. To make sure that we are prioritizing the right work on the Biden Cancer Moonshot, we want to anchor our work to the lived experience of individuals and families who are directly impacted by cancer. We also want to hear from the providers and the clinicians who take such amazing care of them. I encourage anyone to reach out to the Biden Cancer Moonshot through our website, which is whitehouse.gov/Cancer Moonshot, and you will see 2 areas to share stories and ideas. And those are reviewed by an individual who will send that internally so that we can follow up with you. So really want folks to get in touch with us so that we can understand what clinicians are seeing as they integrate these codes and hear from the myriad individuals who have been touched by cancer.